Hey there, and welcome back to the channel. This is the Revenue Cycle Decoded podcast, and I'm your host, Gina Cornett, and we are breaking down all things revenue cycle. And so today we're going to talk about prior authorizations. Prior authorizations can feel like one of the most complex parts of the revenue cycle, but they don't have to be a nightmare. With the right strategies and workflows, you can streamline the process, reduce denials, and ensure patients receive the care that they need without unnecessary delays. In today's episode, we're going to cover the top 10 tips to make sure that you can obtain your prior authorizations. We're going to go into some detail about what information should be included in authorization requests and how to handle peer-to-peer reviews and avoid some common pitfalls like incorrect coding or missing dates of service. So let's get started. So, tip number one is to verify coverage and benefits early. The foundation of any successful prior authorization process is verifying the patient's insurance coverage and benefits as early as possible. Doing this when we're first scheduling the patient can save a lot of back and forth later on. So, here's some things that we want to verify. Is the patient's policy active? Does the insurance plan require prior authorization for the service or the procedure? And are there any restrictions like network limitations or plan exclusions? So, this initial step is going to ensure that you're not wasting time requesting authorizations for services that the plan won't cover, or requesting prior authorizations when they're not necessary. For example, traditional Medicare doesn't require prior authorization for very many services. So, you don't want to waste your time thinking about prior authorizations for most services through Medicare, with the exception of the few that are required. Now, tip number two is going to be to understand the payer's requirements. Every payer has its own set of rules for prior authorizations, and what one payer requires to be authorized, another payer might not, or vice versa. So, knowing those rules is really essential. You need to familiarize yourself with their policies for the services that your organization provides most often. So, a payer may require that the patient have received certain standard of care before they will even consider authorizing a particular service or procedure. Some questions to ask would include what documentation is required to support medical necessity for the service or the procedure that or treatment that you are going to offer the patient. And are there any specific codes or modifiers that the payer needs? And what are the submission timelines? And are there any special forms or portals or gateways that they want you to use? Some payers have a form that they want faxed in. A few payers are still going to require a phone call, and many will want you to enter the information in their online portal or to use something like Availity. So, having the knowledge up front reduces the chances of errors and denials later on in the process. And it also gives you the opportunity to educate your clinicians and physicians on the type of documentation that's going to be required and what sort of pre-work the payer is going to require before providing that authorization. Now, the next tip is to include the right information in the request. So, a common reason for delays or denials is missing or incorrect information. And we want to be very meticulous when you're preparing that submission. So, some of the information that you want to make sure that you're including would be all of the relevant patient information, their name, their date of birth, all of their insurance details, and then your provider information, their MPI, their tax ID, and their contact details. And if the rendering provider is going to be different from the ordering provider, you're going to need to provide that information as well. Then you're going to want to include the service details. So, accurate CPT and ICD-10 codes, dates of service, and some location of service, whether it's going to be inpatient or outpatient. A few months ago, I saw a big to do. It was a very important article that came out about a payer that was automatically, through their AI, denying requests for prior authorization. And many people were very upset about that. But essentially, the AI was set up to reject the request for authorization that did not have the correct ICD-10 codes. So it's, again, important to understand what codes does the payer require that meet medical necessity for this service, and let's make sure that we have those on that prior authorization request. Tip number 4 is to use pre-authorization tools. Many payers do offer online portals or clearinghouse tools to streamline the authorization process, and those tools will guide you through the submission and help to ensure that nothing gets missed. You're much more likely to have a successful prior authorization if the payer offers these tools and you use them. So look for tools that will validate the CPT and ICD-10 codes in real time, that will check eligibility and any payer-specific requirements, and that will provide status updates for submitted requests. Automation tools are your best ally for reducing those manual errors and speeding up the process. And if you do have to request a prior authorization over the phone, make sure that you have all of your information right there, ready to go when you get that payer representative. Tip number 5, submit your requests early. The earlier you can submit that prior authorization request, the more time you have to address any issues that might come up. Best practices would include submitting requests at least 7 to 10 business days before the service date, unless it is an urgent or emergency request, and then allowing extra time for high volume payers or complex cases. Early submission demonstrates your organization's professionalism and commitment to patient care, and it basically makes sure you have all your ducks in a row and you've got time to fix it if you don't. Tip number 6 is to ensure complete documentation. With many of the prior authorization requests, you're going to have to submit documentation to support the request, and that will be critical for approval. And without it, even the most straightforward request could be delayed or denied. So be sure to include clinical notes that clearly justify medical necessity. We always say to our physicians and providers, tell the patient's story. And when we're requesting those prior authorizations, we really need that. We need that clear, concise, coherent note that describes exactly why the patient needs the service or procedure or treatment that is being provided or prescribed. You can include test results or imaging or lab work that supports that diagnosis and any prior treatments that were attempted and their outcomes. So if you're ever in doubt, err on the side of providing more detail, not less. Payers are not going to reject a request for being too thorough. Tip number 7 is to conduct peer-to-peer reviews when necessary. So we do know that payers sometimes deny an authorization, and we think we have done the best job that we possibly can in preparing that packet of information for them. And in some cases, a peer-to-peer review can resolve that issue. And this involves the treating physician discussing the case directly with the payer's medical director. So tips for a successful peer-to-peer review include ensuring that the physician is prepared with all of the clinical documentation and a clear rationale for medical necessity. Schedule the review promptly to avoid delays in patient care, and follow up with the payer immediately after the review to confirm approval. Those reviews, they can be time consuming. They do take time out of the provider's day, but they are often the key to overturning denials and ensuring patients receive the care that they need. Tip number 8, train your team on coding and documentation. Accurate coding and thorough documentation are the backbone of a successful prior authorization request. So ensure that your team has the knowledge they need to succeed. And this includes focusing their training on proper use of CPT and ICD-10 codes, understanding any payer-specific requirements, and collaborating with the clinical teams to ensure that they have detailed notes. A well-trained team is going to be able to spot any potential issues before they become problems. Tip number 9, follow up on pending requests. Once a request is submitted, don't just wait for approval. Follow up proactively. Some follow-up strategies include checking the status online or calling the payer within 48 hours of submission, keeping a log of communication for accountability, and escalating requests if a payer exceeds their standard response time. Following up ensures that nothing falls through the cracks and helps you to identify potential delays early. And finally, tip number 10, review and refine your process. You want to review and refine your workflows regularly so that you can identify any bottlenecks and improve efficiency. Some steps to include would be conducting audits of your prior authorizations to spot trends in denials. Gather feedback from your staff on pain points in the process and work with them to resolve those pain points. And of course, always stay updated on payer changes to avoid any surprises. It's a great idea to check at least quarterly to see if they have any new requirements or new medical policies for the services and treatments and procedures that you provide in your setting. A continuous improvement mindset ensures your process stays effective even as payer requirements evolve. If you are ready to master prior authorizations and other critical revenue cycle skills, I would like to invite you to join my Facebook group, the Revenue Cycle Bootcamp. And that group has been created just to help you resolve revenue cycle issues and provide support and education. And it's also a great resource for people who are new to revenue cycle or who are exploring the career. So I would like to invite you to join. You can click the link in the description below. Thank you so much for watching. Prior authorizations don't have to be overwhelming if you follow these practices. If you found this episode helpful, please like, subscribe, and share it with your team. And if you have a tip for managing prior authorizations, drop it in the comments. I would love to hear from you. See you next time. Peace out.